Member for North Coast.
Thank you, Honourable Speaker. The previous government's focus was on GPs. Our view is to turn to team-based care where health professionals work together to get patients the support they need. This includes nurses, nurse practitioners, pharmacists, and other healthcare providers working in concert to help people. Our focus is to institute team-based care and to create urgent care centers. Urgent care centers would allow people to be treated by nurses. We would be able to pay and incentivize the whole team, including nurse practitioners, not just doctors. Nurse practitioners are so underappreciated, and yet they have a high level of training and a broad scope of practice. They would provide better primary care so as to keep people out of crowded emergency rooms. Less than 1/3 of doctors report having arrangements for patients after hours. So it's no wonder in places like Surrey and Chilliwack or places in rural BC where those even with a family doctor don't have access to care. It tends to push people to the ER because there is no appropriate service after hours or on weekends. So we are proposing and working on establishing urgent care centers that will work with the divisions of family practice to improve access to care, especially after hours. For a long time, the previous government failed to reform primary care. They focused on incentivizing doctors with a fee-for-service system. Other provinces have changed the structure and organization of primary care, moving towards team-based models of care and away from fee-for-service compensation for doctors. Other countries have also implemented incentive payments for doctors, but unlike BC, these models were tied to reporting improved patient outcomes. The costly incentive implemented under the previous government was a $315 annual payment made to doctors on top of regular patient visits for providing ongoing care for complex patients, those that have multiple chronic illnesses. British Columbia now spends more than $50 million a year on this single incentive, and another $100 million on similar extra payments for obstetrics or mental health or management of individual chronic diseases. The incentive payments for doctors fail to achieve the stated goal of improving primary care for patients. For a long time, the previous government failed to reform primary care. Other jurisdictions are far ahead, and we have a lot of catching up to do, but we're going to leverage on their experiences. The GP for Me program failed, where it was promised in the 2013 election and said that by 2015, everyone would have an attachment to a family doctor or nurse practitioner. But today, still 1 in 6 British Columbians don't have access to a family doctor. It's a significant problem, but the only way to start resolving these problems is to start one step at a time, and that's exactly what we are doing. Thank you.